Jackie Davis here, your Medicare Wonder Woman, because I take the wonder out of Medicare. And today I'm going to be talking about Medicare and Medicaid and how you get Medicaid and what that officially means. So a lot of people aren't aware of this, but they can get Medicare once you turn 65 or on disability. And then depending on your state, if you're low income, you could also qualify for something called Medicaid. Now this is provided by your state. Medicare is provided by the federal government, and Medicaid is a state benefit. Now you don't get one or the other. When you get this, you actually get both. So it's Medicare plus Medicaid. And what the Medicaid will do for you, depending on your level, there are several levels, but depending on your level, it could pay your Part B premium cost. It could help pay your drugs, so your co-pays, your deductibles, and the cost of your medication. It could help pay for that. And it could also pay for all your Medicare costs, such as co-pays, deductibles, 20%. Now, that all depends on the level of Medicaid you get. So how do you know what level you qualify for? Well, you have to apply to the state. And generally I tell people, if you're a single person and you make $1,500 or less monthly income, and you have limited assets, because they will look at your assets. Now your home does not account against you, so you're allowed to own your home. But they'll look at your cars, what you're driving, and they'll look at the money in the bank account, if you have 401ks, if you own other real estate beside your house, and things like that. Those do count against you. So if you have limited assets and you're making approximately $1,500 a month or less, I highly recommend you apply for something called Extra Help and Medicaid. And while you're there, you might as well apply for food stamps. It's better to apply and get denied, but not apply and realize you could have qualified for it all this time. Now, with this, there are different levels of Medicaid. So you could qualify for one level and not the other, and that will mean different things. So there's something called QMB. Actually, it's QMB plus. And then there's also regular QMB. There's something called Slim B, as we call it, which is SLMB. And then we have something called QI. And then with the Extra Help, we also have levels 1 through 3. So depending on where you fall in here is different benefits. Anything from here down, you're going to have the Part B paid for. That $148.50 that you're paying right now for your Medicare, it'll pick up that cost. It will help lessen your drug exposure, so your drugs will be less expensive. It will not necessarily pay for your co-pays and things like that at the doctor's office. So what it really helps for is to pay your Part B monthly medical bill and help with your drug costs. Anything here, the Extra Help level, this just helps with your drug costs. It can help with the cost of the plan. It can help lower the premium or the co-pays of your actual drug costs. So let's say you're on a tier 3 medication and you're paying $47 for it right now. It could lower it down to like $3.80 or $5.90 or $8.95, just depending on the actual medication and the level of Extra Help you get. Now, where does that leave this category? Well, this category is a little more special because this is truly your lower income individuals. Of this group of people, they're going to have the lower income. So with this, you're going to get the $148.50 paid for. You're going to have help with all your prescription medications, and you're going to have help paying for the costs of original Medicare. So this plan is going to turn those co-pays and those deductibles into the $0 cost for you. So as long as you stay in network, you're not going to pay anything to go see the doctor or to go to the hospital. And for somebody who's on a very small budget, that's a huge game changer for them to keep their health in check. The other thing with this category, You then open up yourself to something called a dual product plan. It is a type of Medicare Advantage plan that you are now eligible for. These plans help cover the medical, so it works with your Medicaid to help pay for the cost of the Medicare. But then these plans can give you extra benefits that the Medicaid and Medicare together does not give you. So these plans can give you extra dental, extra vision, hearing, transportation. I've seen some with emergency response systems, so emergency systems. There's all kinds of different benefits that these plans can actually encompass depending on where you live and the state you live in and the county. So it's very smart to speak to a licensed agent in your area to see what those plans are available to you. They may have a benefit on it that you desperately need, like dentures, that you can't get with Medicare or Medicaid, but the plan will offer it to you. So take a look and see what's available to you, especially if you're a QMB or QMB plus, which means you're full Medicaid. So you're full dual eligible. Now, in some areas, not all areas, what we call the Slim B on occasion, and sometimes even the QI, can get this plan too. Those plans are fewer and far between, but there are some out there. So don't be afraid to pick up that phone and call a local agent and find out. The only thing you'll be gaining is extras, and you will never hurt your Medicare or your Medicaid in the process. So take a look. I hope this helps. If you need help applying, we help people apply all the time as well. Just reach out to us. Thanks a lot, and I hope this helps.